Good afternoon. My name is Aileen McNabb-Coleman. I'm Chair of the Cayuga County Legislature. Thank you for attending, and thank you to the Cayuga Community College for allowing us to gather in your space today. I'm going to take some time to address COVID-19 in our county. I'm going to introduce Kathleen Cuddy, our Public Health Director, to give us an update of information related to our county.
Thank you, Chairwoman. Hello, everyone. Currently, about 55% of Cayuga County residents are fully vaccinated, with vaccine rates lowest in those individuals under age 55, specifically adults aged 18 to 34 and children ages 5 to 17. Those are the lowest demographic age groups. As with last year, we are seeing a spike in cases since Thanksgiving. Holiday time traditionally has shown an increase in all sorts of communicable diseases, but particularly compared to last year and this year with COVID-19. From November 26th, we have admitted 846 cases into isolation, with 222 of those individuals being children under the age of 18. The health department continues to try and bring and increase the number of vaccinated individuals. We are offering clinics throughout the county. We also encourage people to take part in vaccine available at the state vaccination site, at their pharmacies, and with their healthcare providers. Right now, our focus is on getting our children ages 5 and older vaccinated. We have attended and provided vaccine clinics in our school districts throughout the county. Only 30% of the cases since Thanksgiving have been breakthrough cases. That's telling. That's telling us that the vaccine is working to help prevent positivity rates. If you have not received your vaccination, we encourage you to do so as soon as possible. If you are vaccinated and have not received a booster, you are also encouraged to do so. As stated, the vaccine is available at various locations, and we are so pleased to provide it within the health department, but we encourage you to get that vaccine wherever you are able.
Thank you, Kathleen. The statewide mask mandate ordered by Governor Hochul, announced on Friday, went into effect yesterday, December 13th. I wanted to clarify some questions I have received about this mandate. This temporary mandate is in effect for New York State until January 15th. This requirement was put in place to help reduce the increasing number of hospitalizations from COVID-19 observed across the state. As your county leader, I am in communication with emergency management regularly. Cayuga County continues to receive multiple notifications daily from the New York State Department of Health regarding the intake status of hospitals throughout central and upstate New York. Currently, patients are frequently transported significant distances from central New York to find available hospital treatment and bed space. Transporting patients by ground and air ambulances to New York City, Rochester, Buffalo, and other distant locations appears to be increasing based on changing hospital availability. The New York State Department of Health diversion notices include 2 categories of interruption: emergency department diversion and service limitations. The hospital diversion for ambulances means current patient load exceeds the hospital's availability to safely treat additional patients. Patients can walk into the emergency department and receive treatment. In some cases, the Syracuse hospitals are all on diversion simultaneously, requiring them to go into New York State DOH planned hospital rotation for accepting patients. While many diversion timeframes are for 4-hour increments, some now start at an initial 12-hour duration. As you can understand, if our county or region were to continue to increase the number of COVID cases, these constraints will become even more critical. This is what the mandate is trying to help our region avoid. Regarding the short-term mandate itself, here in Cayuga County, it's important now more than ever to provide businesses and venues, hospitals, long-term care facilities, schools, and any public setting. They need support during this time. That support comes from both the health department and from residents. The Cayuga County Health Department will follow up with complaints first with education and outreach in order to help our local businesses during this time. As residents, our role is to comply with the requirements set by the business under this temporary mandate. Our local businesses have been through enough, and it's not their fault that this mandate has been activated. Please be patient with all establishments as they choose to operate their businesses under this mandate in a manner that works for them. This could occur in one of two ways: a mask requirement for all staff and patrons, or a vaccine requirement for all staff and patrons, not a combination of both. I recognize the trauma of COVID and its variants, as we have lost 113 family members, neighbors, and friends from COVID-related illness in this county. I also recognize the trauma of the implementation of safety protocols, such as missed school, missed work, loss of a business, and the inability to check on a loved one in the hospital or in a long-term care facility. This pandemic has been devastating for all of us. In closing, I have two asks. First, in order to starve this pandemic and keep it from spreading, please get vaccinated. My second ask is to please support our local businesses by respecting their choice on how to handle this mandate. It is not their fault. And please remember, this is a short-term mandate that is expected to be lifted January 15th. Thank you for attending, and I will answer any questions you might have.
I'll start with just two questions. One is, are we seeing any common thread in these cases that really since Thanksgiving have popped up? You know, is it indoors, family gatherings, that kind of thing? I know that was a problem last year. In terms of the enforcement of the mask mandate, it will be the same as there was during the previous mandate when there was a health department that various businesses during the course of inspections check on that.
Sure, I will ask Kathleen to answer in for the health department. Give you clarification.
Thank you. So there are some areas where we have seen some outbreaks since Thanksgiving. For example, certainly family Thanksgiving, where numerous families were together and there was a positive person there. We've seen associated positive cases. We've also seen cases emanate from a band performance that was done around Thanksgiving time. And also at some sports gatherings and with sport participants. So we know that those group gatherings, again, with people outside your own household, tend to be the most common manner in which COVID is spread. And when it comes to enforcing the mask mandate, yes, that request is to have it go through the health department, and that is what we will do. As our chairwoman stated, we start with education, and then we follow our standard procedure, which would then be to follow up as need be, and then to bring those concerns to our Board of Health for appropriate action.
Aileen, just a real quick question for you about the hospital situation. Any concern with Auburn Community Hospital, and you know, how are things shaping up there right now as we deal with this?
I have not spoken with any representatives from the hospital today or yesterday, but last week they were holding their own and feeling rather confident in their numbers and their census and their ability to help those individuals there. You know, I wanted to also have this conference today because I've been getting requests of, you know, don't enforce the mask mandate or ignore the mask mandate. It is not a situation where anyone is flexing political muscle. This is a situation for our region, not just our county, but our entire region and the state. based on this hospitalization that we're seeing because of the increase in the surge of COVID-19, and the fact that, you know, we are also under the pressure of the previous mandate, which means we have a shortage of people in the workforce. So in the medical area for nurses. So it's been very difficult, and we don't want to get to a point where this pandemic outgrows this region. And we're heading into the holidays, and it's a critical, very, very critical time to take personal responsibility, to mask, to distance. You may want to avoid those gatherings, or if you want to make sure everyone that you're gathering with is vaccinated, you have the right to step up and ask those questions, you know, for the people that are around you. This is just a very critical time. The last thing I wanted to see is a statewide mandate. We know mandates are very difficult, and there's a lot of pressure that goes along with it. I was kind of sad to see that it's gotten to this point, but I understand why, and I want the public to understand why this is so important. So please do all you can, get vaccinated, take personal responsibility. Please support our local businesses, especially this time of year. And you know, again, they didn't choose this, and so they're going to choose what's best for their operating environment.
Is there any very new variant Omicron? Is that President Cayuga County?
It certainly could be. We do not have verification of that. My understanding is that our neighboring counties had their first identified case of Omicron. So if it's next door, it will be our way shortly.
Is there anyone online with a question? Type it in the chat.
I see we have one in the chat now.
So the question is, some counties are handing out free at-home tests. Is that something Cayuga County is doing or planning on doing? And that's Kathleen to reiterate that. I know we have a plan for those tests. So I'll let you explain.
So our county does not distribute free at-home tests, but they are available at various stores. The tests that we have received from New York State are being used appropriately so with our school districts. And we are accepting people utilizing at-home tests because a positive is a positive. And sometimes that's the easiest way to have that verification. So if you call the health department, we can walk you through how to submit that information. Do not throw away your test. Put your name, your date of birth, and the date that that test was performed, and take a picture of that. And if you call the main line at the Cayuga County Health Department, 315-253-1560, you will hear a pre-recorded message that tells you the manner in which to submit that information. But we certainly want to encourage people, if they are having symptoms, to also see their healthcare provider. COVID is not the only illness that's in our community, and people need to be appropriately assessed. And at times, symptoms can come upon us very quickly, and people should seek the appropriate health care to alleviate those symptoms.
I don't see anything else in the chat right now.
Okay, at this point, I don't see or hear any other additional questions. I thank you so much for attending today and for listening online. And again, I thank Cayuga Community College for this setting today. Thank you.